The year 2020 has become the year of COVID-19, and it's changed all of our lives. As a new virus, doctors and scientists and public health officials studied history to understand how pandemics work, how viruses spread in our community, and what we could do to tamp down the spread of the virus. In St. Louis County, we put in place public health orders even before we saw widespread virus in our community, but we saw the toll that it was taking elsewhere, and we knew it was only a matter of time before the cases would be here in St. Louis County. As a result of that early action, we avoided the devastating impact in our community, but the spread of the virus will continue until we have universal acceptance of mask wearing in our community and social distancing. When the pandemic first hit the U.S., one of the biggest challenges was the shortage of tests. The shortage led to outbreaks that could have been prevented or better controlled if we had better testing from the get-go. Today testing is much more available here and across the country, and it lets us better understand how the virus spreads in our community, how to instruct people on quarantine, and how to get them the medical help that they need. The county is expected to spend $20 million this year on testing. We recently purchased 30,000 saliva tests, and we began administering those tests Wednesday in our public health facilities. The nasal swab, or the PCR test, continues to be the gold standard. And in our public health facilities, we will continue administering the nasal swab test in addition to the saliva test. And it's important whenever investing in a new technology that we compare it to the gold standard to make sure that the results are accurate and reliable. We anticipate that the saliva test will be a more common testing tool and will allow us to diversify the types of tests that we offer in our public health department. And we know that we're going to need tests for several months. We'll continue to purchase more tests and to try and improve the diversity of the tests that we offer, and I'll certainly keep you updated on that as well. When testing first began in our region, it was only available through the hospital systems. They were the only ones available to purchase tests, the only ones able to do it. But once the health department was able to purchase tests, we began deploying them in North County and South County and in pop-up locations wherever they were needed. By June 15th, we were able to broaden the criteria for tests, and we were able to offer tests to anyone who had frequent and regular contact with members of the public. Doing so was possible because the testing was more available. With funding from our CARES Act grant, we've been able to expand partnerships in the community, especially through our federally qualified health centers, so they can expand the testing that they're already offering, especially in communities that have been disproportionately impacted by the virus. We have set aside $4 million to improve our testing footprint in the county, and we will continue to do that. On Monday, we announced a partnership with People's Health Centers, and they received $478,000 to expand COVID testing in our community. They will begin offering tests on August 15th, and we expect an announcement soon on the hours and the locations and the days that those tests will be offered. Also this week, we awarded $1.5 million to CARE STL for them to expand testing in our community. CARE STL is a nonprofit, federally qualified health center. They will be able to perform at least 700 tests per month throughout the community in multiple locations, many of these also in North St. Louis County. For more information, you can see carestlhealth.org or call 314-COVTEST to make an appointment. You can always follow along what the county is doing on our portal, our transparency portal at stlcorona.com. You can see the CARES Act budget as it's being spent and what we have committed in the future, and then the budget as anticipated for the coming year. This includes checks that are being sent to small businesses in our community as part of the economic relief efforts. My office continues to work closely with the County Council, their Oversight Committee, as they help to advise and direct us in the spending of the funds to get them to the areas that are needed the most. And this includes daycare, utility assistance, rent assistance, food distribution, and of course, expanded testing. So please continue doing your part to help us limit the spread of COVID in our community. That means mask wearing, social distancing, and frequent hand washing. And I would be glad to answer any questions. Doug, do you have anything?
I just wanted a point of clarity. The Peoples was 578,000.
578,000 to Peoples. That's correct. I may have misspoken today.
Other than that, I don't have.
Any other questions? Questions? Questions on Facebook Live? Okay. Thank you very much.